Hi, everybody. Welcome back to the WHN broadcast. My name is Ben Calderwood. We're joined again today by Dr. Eric Feigl-Ding. Eric, you spoke to my colleague Karen just a little while ago regarding the emerging threat of bird flu H5N1. We wanted to follow up with you today and talk a little bit about the potential for mammalian adaptation, of course, the flu jumping from birds to mammals to cows. And what is the likelihood of it ultimately being able to transmit effectively human to human?
Yeah, that's a very good question, and that's the wondering question everyone has. In certain ways, we know it's not a matter of if, it's a matter of when. But the matter of when is tricky because it's kind of like saying, well, we know Kansas is going to get hit by a tornado at some point. We just don't know when the next one is, or we don't know when the next earthquake will hit California, but we know it will come. I think the mammalian adaptation, last year there was an article that basically discussed what is the worst, one of the worst mutations, and it's one of the mutations in the PB2 polymerase gene of the virus, and it would be this E627K, and that's, they say, is one of the most critical mutations that you need for mammalian adaptation. And guess what? Last month in April, the CDC report says the man in Texas with avian flu had exactly that mutation. Now, this mutation has popped up many times before, including in the great 1918 influenza, as well as a few other influenza pandemics. But that in itself is not enough. There are several other mutations needed before it can truly go human to human. But that mutation, which again we already identified, is one of the hallmark mutations for mammalian adaptation. So, but I think it's not efficient enough as a human to human just yet. But I want to remind people that people's eyes can have the same receptors for the virus that birds have. This is why human eyes are more susceptible than the rest of our bodies, and that's why oftentimes they warn, a pink eye conjunctivitis could be a potential hallmark of the virus, although there are many other causes for it. Now, Jeremy Farr, the chief scientist of WHO, says he's also very worried that it is approaching the brink of jumping the human because one thing, it's if it's infecting elephant seals or penguins far away. It's very different when it's infecting cows, milk. 1/5 of all milk nationwide has been positive. Even though seemingly pasteurization will neutralize it, although we haven't had the definitive data yet, just preliminary data that likely it will neutralize. But we know that given how proximity cows and cattle are to humans, and cats and dogs are also very susceptible, as we know. This amount of exposure to humans is where it starts to get interesting because we are surrounded by these mammals while we're not surrounded by elephant seals and migratory birds necessarily. So again, it's a matter of time, but the more we're exposed to it, the more chances the virus will have. And especially if the virus infects the pig, pigs are susceptible to human influenza as well as avian influenza. So if it co-infects unluckily in a pig, and then the virus admix between an avian influenza and a traditional human influenza within a pig that can get infected with both, you could get a swapping of genes that could yield the worst of both worlds. And I think that's where, these industrial high concentration farming, it's risky. You can't ban it, of course, right now, but it increases the likelihood a lot. That's why we believe it's a matter of when, not a matter of if.
Matter of when, not a matter of if. Yeah, there's a lot to look out for. Bearing all this in mind, bearing the likelihood of human to human transmission that you describe, how should we at this stage of the game be tracking and testing for H5N1 moving forward?
Well, the CDC and USDA are trying to do more testing. Interestingly, although we've only heard of 2 cases so far this year, and 1 case in that Texas man with conjunctivitis last month in April. Upon further investigation in the New England Journal report about that man's case, it seems that they didn't actually do much other testing. They only tested 30 other people so far, which is really worrisome. That man actually, they don't actually know where he works, and they weren't able to contact trace and test other close friends, associates, and coworkers, because I think there was some concern about privacy about the man. I think he didn't want to be identified for various reasons. I think could be one of those undocumented farm workers, right? Which we know is very common in the farming agriculture industry. So we don't actually know like how far it's spread. We actually don't have detailed data on human-human transition. We just happen to catch one case by sheer luck, but we don't have other testing. Now, they are going to test more dairy cows and other cattle that are shipped state to state. But there's a lot of pushback from the agriculture industry. It's like, see no evil, test no evil, hear no evil. There, supposedly there is no virus floating around, and I think this is the ostrich. We're putting our heads in the sand like an ostrich, and I get it. They don't want to suffer, agriculture, fallout from this. But and the USDA, remember, is not a health agency necessarily. Although they have a food safety division, USDA is the commerce industry of the agriculture industry. So there's been a lot of pushback in terms of public health testing and trying to trace this. And this is where public health and politics are starting to mix. And some people say they shouldn't mix. That's true, they shouldn't. But I always remind people, public health is policy, policy is politics. And we're unfortunately, handcuffed by the policies and politics of the day, the rules over public health. And this is why people really need to understand this is a serious concern that jeopardizes much more than just temporary disruptions in dairy and poultry industry.
As always, thank you, Dr. Eric Feigl-Ding, for giving us your opinion on the current state of bird flu in this country, connecting public health to policy and politics in turn. We'll probably have you back soon to talk more about this. And if you would like to learn more about what we do at the World Health Network, you can find us online at whn.global. We hope you'll visit the website and consider joining. Thanks so much. We'll see you in the next news update. Bye-bye.